achievable. There are two types of injections, uniphasic or multiphasic. Uniphasic injections are done at a constant rate. There's no arterial enhancement plateau, and it's a hunt-shaped time enhancement curve. Biphasic or multiphasic injections have a plateau-like arterial enhancement. If you look at the graph, that would be graph B. It's achieved by injecting contrast at two different rates. An initial small volume of contrast is injected faster than the remainder of the contrast. So you say you're injecting a total of 100 mLs. You're going to inject maybe 20 mLs at 4 milliliters per second, and then the remaining 80 mLs at 2. You're going to get a plateau of arterial enhancement. Now there's also a saline flush injection used, and it's done with a dual hit injector, usually 25 to 50 mLs. It can be done as a test bolus before the contrast bolus to test the patient's IV to make sure it's going to hold that injection rate. And it's better to have 25 cc's of saline infiltrate as opposed to 100 mLs of the contrast. And it's also done as a post-contrast injection for several reasons. It clears the residual contrast from the IV tubing. It accelerates washout from the arm veins, provides an effective 10 mLs to 25 mLs of additional usable contrast. It improves organ enhancement, slightly prolongs vascular phase for angiographic studies, and it reduces the amount of contrast needed by 25 mLs. It results in cost savings, lessens the risk of contrast nephrotoxicity, and reduces streak artifacts. The streak artifacts that you might get as the contrast goes in through that brachiocephalic or the subclavian vein. Now you need to screen your patients to see who can get contrast and who can't. There's a lot of reasons. They could be allergic to it, or they could have compromised renal function, and the contrast is hard on the kidneys, and we don't want to send them into renal failure. So the patient medical histories are very, very important. You do these to determine if a patient should receive the IV contrast. And some of the questions that you may ask are there allergies to food or medication? Have they had IV contrast before? If so, did they experience any adverse reactions? Are they diabetic? Do they take any of the following? And all of these medications contain metformin in some form. They don't want to take any product containing metformin for 72 hours after they have the exam done. Or some say 48. So we could say a rule of thumb, 48 to 72 hours after they can begin their metformin again. We also want to get creatinine and BUN levels to determine the GFR. We get these on depending on where you work, but generally anyone over 65, anyone with diabetes, anyone with a history of renal disease, and even high blood pressure. Now, using that GFR, every place, if the GFR is under 30, equal to or less than 30, they don't get IV contrast. We don't want to send them into renal failure. At MCV, I know they do it where if the GFR is below 45. And there's some other compromises that are done. They have some hydration protocols that are done if the GFR is below 60 and above either 45 or 30, depending upon where you work. They do a hydration pre and post test. And the protocols are given by the radiologist, but this would be a sample protocol. With a GFR between 50 and 60, you get normal saline before and after the contrast injection. If it's reduced to 40 and 50, they'll add Mucomyst to that. And if it's between 30 and 40, they may hydrate that whole 24 hours prior to it if the IV contrast is necessary for the exam. Now, besides IV contrast, there's oral contrast. Oral contrast is used to highlight the gastrointestinal organs in the abdomen and pelvis. If oral contrast will be used during an examination, the patient will be asked to be NPO for at least 4 hours before the exam. Oral contrast is given when you want to see the lumen of the bowel. It's usually given for every abdominal and pelvic CT, except for stone study. High-density oral contrast is not given for CTAs of the abdomen, renal studies, as well as mesenteric studies. Water is used instead, or any kind of negative contrast, water, milk. The oral contrast, the ReadyCat and the Scan-C, are what's called a positive contrast. Let's go over the different types of contrast. You have the Scan-C, which we talked about before, which is a barium sulfate. You have Gastrographin, or sometimes called GastroView. And now some places are using a dilute Omnipaque, where it's diluted 100 cc's to a gallon of water, and it's actually, instead of injected, ingested. Now those are examples of positive contrast. And then you have water that can be used, and that's a negative contrast, and milk can be used also. Oh, yes. Now let's talk about rectal contrast. Rectal contrast is used when enhanced images of the large intestine and other lower GI organs are required. A lot of places may use rectal contrast if it's a suspected API. Instead of having the patient drink and waiting an hour, they can immediately give this rectal contrast and get the result that they need. The same types of contrast used for oral contrast are used for rectal contrast, but in different concentrations. Rectal CT contrast is usually administered by enema. When the contrast is administered, the patient may experience mild discomfort, coolness, and a sense of fullness. After the CT is complete, the contrast is drained and the patient may go to the bathroom. The preparation for rectal contrast is similar to oral contrast in that the patient should be fasting for several hours before the test. In addition, the patient will be required to use a Fleet's enema to cleanse the colon. It's usually used the night before the examination, and you have the same side effects as the oral contrast. In short, you want to take a lot of things into consideration before using IV and oral contrast. And there's further information in the notes on oral and IV contrast and the precautions for them. So when you're administering the contrast, remember their main variables: scan timing, the contrast amount and density, and the injection rate and technique. There are advantages and disadvantages, and remember how the contrast is circulated around the body.